Hello, everyone. Now we're going to talk about wound management and what we have to do in different types of wounds, what each wound is, etc. Okay. Let me share this guy. Okay. So wound management. So remember when we were talking about I guess the inflammatory response lectures that I was talking about healing by first intention or healing by second intention, and how healing by first intention generally means that the wound is an intentional wound, such as a surgical incision or a wound that you can actually approximate the edges of the wound. And then healing by second intention comes from the inside out, and you can see that healing by first intention, this is depicting granulation tissue. It's going to be very little as opposed to granulation tissue that occurs in healing by second intention, and there's a little bit more angiogenesis that happens in that, and the scar in the end, as depicted here by this little contraction, is a little bit bigger when you're healing by second intention. So there's different types of wounds, and we're going to talk about them. This is not a vet school, so we're just going to talk about what different wounds mean and how it's what to do about them. But abrasion is a scrape. So when a horse scrapes against something like a bite mark or a kick can lead to an abrasion. There's generally this little liquidy thing. It's transudate. That happens. An abrasion, it can be painful, but it generally heals without any complications. The hair is removed, the first layer of skin is removed, but it generally heals without any complications. Sometimes abrasions on legs can lead to what we call cellulitis, and that can be a problem, and it needs to be healed with or treated with antibiotics. Hematoma is a collection of blood into a pocket, okay? So the difference between a hematoma and a bruise is that the bruise was also happened because of a contusion, and the same can be with hematoma, like a blunt trauma such as a kick. But the hematoma, the blood is all collected into a pocket. If you insert a needle, blood is going to come out. It's not frank blood, so it's not blood that is red, and it's blood that is already starting to degrade. In a bruise, the blood is going to be coagulated underneath the skin, so that's generally the difference. In hematomas, because it's a collection of blood, and there's nothing that bacteria like to grow more than blood. Blood is the #1 medium for bacteria. You just need to worry in the hematoma. Generally, the body will resorb all this blood, but like, for example, in this case, it looks like it was a kick. And it can be a problem because you can actually insert bacteria in this little area, and then it can become an abscess. So hematoma is generally left alone. The veterinarian may want to come and remove it with a needle, but by removing it with a needle, you actually may be introducing more bacteria in it. But it can become an abscess, and an abscess you have to lance it and let it drain and treat with antibiotics. Contusion is like when you hit something, and this is depicted here by a bruise. So that's what a contusion is. Generally, unless there is other things that are involved, it generally heals without a lot of a problem. Puncture wound. This is a nail in a horse's foot. Puncture wound, the definition is that it's longer than it is wide. Okay, so that's what a puncture wound is. It can happen, in this case, there is a nail there, so you are going to have to remove it. One of the things, rule of thumb, is that you don't remove the nail. You let the veterinarian come over, because they're going to have to x-ray first to see what was involved, what tissues were involved, so they can actually have a plan of attack on how to treat this wound. Generally, puncture wounds, doesn't have to be on the foot. It means that, because it's longer than it is wide, a scab can form really quickly at the end of this wound, which means that it maintains a very nice anaerobic environment, and if horses and the environment has Clostridium tetani and a lot of bacteria can be inserted into this puncture wound, and after the scab is formed on top, it can lead to tetanus if this horse is not well vaccinated because of the anaerobic environment that is going to be formed. An incision, it doesn't have to be an incision that was made during surgery with a scalpel. So like a nail on a fence and the horse goes like this. This is what happened here. So an incision generally means that the wound, the edges are possible to approximate, and it's not all ragged. So you see there's a little raggedy going up here, but it's easy enough to approximate that. An incision generally, if caught soon enough, it can be sutured without major complications, okay? As opposed to a laceration is bigger, okay? And more structures are involved. In this case, a few layers of muscle is going to be involved. And in a laceration, it's not always. You can try to approximate some of the edges of the wound, which ideally you would instead of just leaving it open. I hate when veterinarians just leave it open, say, deal with it. No, I try to approximate, because as approximated, even if the skin, even if this skin here dies, when in a week from now, at least for that whole week, that area was protected from the environment, from getting dirty with manure, etc. But laceration means that other structures were involved as well, not just the skin. What else did I want to say about this? The other thing that annoys me is when veterinarians don't clip the area around the wound before they stitch it. So this is a complicated wound. Obviously, this horse was impaled by a fence. As you can see, this is the elbow of the horse. This is the abdomen, okay, of the horse. So like horses that try to jump a fence and don't clear it. This sometimes is what happens. And this is very complicated. There's multiple multiple structures involved. Some areas are already starting to look a little bad. And you have to try to approximate as much as you can in different areas, and then heal with a lot of antibiotics, a lot of treatment. But that's what a complicated wound is. And again, veterinarians should clip, with hair, remove the hairs before they try to approximate on the edge. But as you can see, trying to approximate this guy here and also this guy here and up the, it's just difficult, but it needs to be done. A burn, this can be fire. It can also be, chemical burn. The thing about fire, and I think that that's one of the things that people don't realize, is that it burns the skin, but it continues to burn downward. So one of the best treatments for burn victims, or even when you burn your finger in the stove, is to actually keep it in cold water to cool down, because even after the fire is done, this continues to burn inside. And there's a lot of, because the skin is all exposed, it's all removed, there is a lot of infection that can happen in a burn victim. There's 3 phases for the healing of these wounds. The number 1 is the inflammatory phase. And if you guys remember from the inflammation lectures, we're gonna have the clot. There's gonna be this clot of blood is going to have a lot of protein, a lot of white blood cells, and it's going to provide the scaffolding for the migration of new cells. There's nutrition in that blood. If you guys have removed teeth, for example, you will remember that the doctor may have said, don't spit, because every time that you spit, hold on, my dog is barking. Every time that you spit, you remove the clot. And when you remove the clot, it is not ideal. Okay, let's see this guy. Oh, wow, I'm recording. So the other one that happens in this phases of healing is the granulation. And granulation cannot happen until the blood clots. Okay, this is important, because if there is still blood leaving from the wound, and there is still blood, if the wound is still bleeding, there is no way for the body to actually start to granulate the wound. There's going to be necrotic tissue, there's going to be debris, infection. They all need to be eliminated before the body can start to heal, before granulation can start to happen. And granulation tissue, we're going to have angiogenesis, which is new blood vessels for blood supply. And it's going to make, and I already talked about this, it's made of very loose extracellular matrix. And you need to be careful to make sure that the granulation tissue is healthy. And sometimes you need to remove it, and sometimes you want to leave it alone so it can start to heal. Granulation is going to continue until this thing here happens, which is called epithelialization, which is a deposition of skin cells. The third phase of the healing is contraction and epithelialization. So some wounds will contract more depending on the area, and some wounds will contract less, like wounds on the torso of the body and like the rump, they will contract a lot. Wounds on the leg generally don't contract much because there isn't a lot of tissue. They take longer to heal, and generally wounds on the leg of horses specifically lead to a lot of granulation tissue that can become a problem. And I'm going to show a few photos here. Contraction and epithelialization is a slow, it starts within hours. They contract soon, but it's the slowest process. The cells are going to migrate centripetally, going from the inside to in. This epithelium is very fragile and not very adherent. So it just have to be very careful as you're removing bandages and stuff to not continue to remove this epithelium, because like I said, the body runs out of resource and start to just dump fiber on it. So it's something that is important to understand the types, in the phases of the healing. So as you can see, laceration here, this is the chest of the horse or the shoulder of the horse. And this is, so hard to approximate. And this is a week or two afterwards. And you can see how it is contracted here. And you can see that the contraction is totally visible because you can see it's a little bit more tight and brought to the center. Okay, let me delete this so you guys can see, but you can also see in your PowerPoint. Granulation tissue, this is what granulation tissue looks like. It is, it's going to provide the surface for epithelialization. It is very resistant to infection, but it's not, it doesn't mean that it doesn't get infected. It can very much get infected, but it is resistant because the amount of new blood vessels in the area and also the number of macrophages in the area. So it is very much resistant to infection. And granulation tissue is very much necessary for the wound contraction and for the wound to heal. Hold on just a second. So factors that are going to delay healing, there is multiple of them, but location is probably one of the most important. Wounds that happen in the limbs are going to heal much more slowly than the other ones because you don't have a lot of tissue in the limbs. You have bones, you have connective tissue, and then you have tendons, and you have skin. That's pretty much what you have in the lower limbs of horses. So because of that, because of the decreased vascular supply, and there's bone prominences, and there is no deep musculature that would provide a lot of the nutrition to the area, it becomes a problem. That plus the fact that there you have highly mobile joints in the lower limbs of horses, and because it's closer to the ground, you have a higher degree of contamination. So location alone is a problem, and it's going to delay healing. So wounds generally in the lower limbs are problematic. Wounds to the face, because there's so much vasculature on the face and the head, will heal very fast and generally leave very little scar. On the trunk, same thing, can heal fast. On the rump, same thing. They can, fast, it depends obviously on the size of the wound. Infection, there is no healing that can happen when there is infection. So depending on the type of the wound, you're going to treat topically with products, or if you're going to have to do antibiotic therapy. Movement, so if a wound that is on top of a joint and continues to move, it keeps breaking the granulation tissue, keeps breaking the new epithelium. So a lot of the times wounds have to be stabilized and immobilized to be able, so they stop moving so it can heal. So that is generally a problem, okay? The dimensions, obviously, of the wound is going to be a problem. The involvement of deep structures. If you have poor blood supply or oxygen supply, so a horse that also has pneumonia or anemia, horses generally don't have a lot of anemia, but some of them do, or poor blood supply. So wounds that happen, say, in the dead of the winter, can be a problem because all the blood vessels of the surface are going to be constricted because of the cold. So in those cases, it's better to maintain the horse in an area that is a little warmer if you have a barn, or if you can take the horse to the hospital where it's climate control, because poor blood supply is going to delay the healing of a wound. Foreign bodies. And the word is foreign bodies, it's not foreign objects. Okay, so object is like a pen, a pencil, a hair tie. This is foreign body, even though it's not a dead body of a person. Okay, so it is sand, wood, necrotic tissues, hair, they can all act as foreign bodies. So when you have that inside a wound, the body tries to heal, but because that particular thing is there, it's going to create more granulation around. It's going to try to involve it, and it creates more fiber, more tissue, more granulation. It becomes a problem. So it's very important that wounds be cleaned very much so, as much as possible before they are sutured. Sequestrum. Sequestrum is a piece of bone that dies, it necrotizes, and say, for example, because of a blunt trauma, there is a cut on the skin, but also the bone got that trauma, and that area of bone is going to die, but it takes about 3 weeks for the thing to die, and then wound doesn't close. If it's been several weeks and the wound is seemingly small and it hasn't closed, the veterinarian needs to come over to take an x-ray to see if there is a sequestrum. If they see that there is a sequestrum, they need to wait for the sequestrum to be totally formed to then remove it surgically. So it's not fun, but it happens semi-often. Nutritional factor, a horse that is super skinny, malnourished, obviously the same, that goes for people also, will not heal as well. Previous treatment. So a lot of the times veterinarians arrive and they're like, oh, this wound happened, so just to help you out, and then you add what they have added to the wound. So there is a lot of ointments that actually delay healing. One of them is furosin, and it's readily available for owners to buy, or wound care, that copper, not a spray, powder that people put on wounds. Those will delay healing because they actually kill the new cells as they kill the bacteria. Also, they kill the new cells, and that is going to delay healing. So anything that's oil-based, petroleum-based, will delay healing as well. One of the, so if the veterinarian needs to come and assist this wound, it's better to just immobilize the horse. Don't help him to not get the wound even more dirty. You can maybe wash the wound if it's, if it is, there's so much manure and dirt in it, or if it's bleeding, you can put towels and then continue to bandage the area. And if it stops, or if you see blood coming through the towels, you just add more towels to it. Never remove the one, you just continue to add. So you can do those things, but never add ointments or powders to the wound, because you will delay the healing of the wound. Age of the wound, wounds that are like 6 months old already are a problem. Okay, so it's better when you have a wound to start treating it as soon as possible with the correct treatment. And obviously, economic factor, there are some wounds that are expensive to heal. My dog. So this picture here is going to show granulation tissue. This is not, well, come back. This is not necessarily wonderful granulation tissue. It looks a little old. You can see the edges of the wound are not, it needs to probably, this is, it is moist, as you can see, but it needs to be probably excised so the edges of the wound can be approximated. This, you can see, this is different from this guy. This guy here is dry, super dry. This is old granulation tissue. It's like necrotizing here. It's old and dry, and wounds cannot heal if they're dry and nasty, okay? And as you can see, the body is continuing to deposit even more granulation tissue here and here. It's just not okay. This needs to be fully excised. This here, you can see it's a very angry granulation tissue. It has infection. There is an infection going on here that hasn't been cleared. So this needs to be fully cleared. And as you can see, this granulation tissue is much taller than the edges of the wound. And it needs to be also excised. This is what a sequestrum is. So you can see this is a wound that is open, as you can see by this guy here. And this via x-ray. So this is the edge of the skin of the horse. And you can see this wound is open, and you can see on x-ray the sequestrum, okay? And that needs to be removed surgically. There's no other way around it. So to manage a wound, so the first thing that we need to do is to stop hemorrhaging. So hemorrhage control, like I said, you put towels, hopefully clean towels, not towels that you found in a car shop. And you are going to, if you continue to see blood coming through, you are going to just add more towels. So a lot of the times, wounds in horses don't bleed a lot, which is shocking. Sometimes if there is arteries involved, they're just going to continue to spurt blood, and a horse can actually bleed to death. So you just need to, hopefully find him soon enough, and hopefully there's no large artery involvement. The initial cleaning of the wound, it's better to clean with saline than water, because water, water has other things that are not physiologic, such as, if you use city water, which is my preferred water for drinking for horses. There is like treatments, there's chlorine, etc. But if you don't have saline, you're going to have to use water to try to remove all this debris that is on top. Like I said, to better assess a wound, you need to be able to see everything that's happening. So it's better to clip the hairs around the wound. But before that, it's better to do like water, hydrogel on the wound. So as you clip, hairs don't fall in the wound. Some people just put gauze, that's fine too. So as you clip, the hairs don't fall in the wound, because these hairs can actually become foreign bodies later on. Once hair sticks to a wound, it's close to impossible to remove. Clean the wound with, remember I talked about previous treatment. So one of the best disinfectants that is least offending to a new wound is going to be 0.1 to 0.5 chlorhexidine. So you can do that to start killing, the microbials in that wound. Flaps of skin should be lifted and flushed underneath, and do not wipe the wound after it has been flushed. So a lot of people just like flush and then go and pat dry with paper towels. Don't do it. Just let the disinfectant just stay there as long as it can, because it kills the bacteria by contact time. Plus, every time that you tap or you try to dry it, you are actually inserting more bacteria and more things to the wound instead of removing it. To assess the wound, depending on the horse, depending on the location, depending on the dimension of the wound, the horse may need to be sedated, tranquilized, anesthetized with local anesthesia. So it's something that needs to be done. The idea is to prevent further injury and contamination of the wound. And if the wound is all ragged, the veterinarian may come and try to, convert an accidental wound into a surgical wound. So try to clean it up surgically before they start to approximate the edges of the wound, before they start to stitch the wound. Okay, so there's going to be a lot of assessment happening. Instead of cutting the flaps of the skin with scissors, it's better to use the scalpel, because scissors will actually crush the blood vessels and tissue, and scalpel just makes a clean cut and leaves those tissues alive. The idea of the wound is to actually provide a moist environment. Hold on just a second. Like I said, wounds cannot heal if they are super dry. So ideally, if you're going to bandage, if a wound is going to be bandaged, it needs to be kept moist, and some of the most advanced bandaging for wounds provide that moist environment for the wounds to heal well. Like I said, oil-based, so petroleum-based ointments are not the best for wounds, like ictamol, and water-based, such as SSD, so silver sulfadiazine. That white cream is actually one of the best topical creams for wounds. A lot of the times, if the veterinarian is going to suture the wound, they are going to, depending on the size, and like I said, it can happen that the wound is going to open up later, but even if you can help for a week to keep the wound closed, it's actually much better. Suture dehiscence is a result of infection, of skin loss, like there's too much tension in the wound, in the suture line, etc. So dehiscence is something that happens. The veterinary tries to all they can to try to prevent that from happening. Tetanus vaccination. So depending on the wound, the horse may need to receive a vaccine for tetanus if he hasn't been vaccinated in the last 6 months. Generally, tetanus vaccine is once a year, but it's something that the veterinary is going to ask the vaccination status for that horse. Antibiotics may be used sometimes because infection will delay healing. So if the wound is super contaminated, definitely antibiotics are going to be used. A lot of the times they're going to be used if there is suspicion of infection as prophylaxis, okay? So it's important to use something that is convenient for the owner, because if you have to do something like 3-4 times a day, owner compliance becomes a problem. And like I said, it's important to finish the course of antibiotics to prevent resistance. We already talked about this in the antibiotic lecture. And sometimes the veterinary will start with parenteral antibiotics, such as IV injections or IM, and then leave the owner with oral antibiotics. When we're doing wound lavage or flushing, the idea is to remove the dead tissue, bacteria, foreign matter, without compromising the physiologic status of the new tissue that is forming. So the idea of a wound lavage is to use this disinfectant that is diluted in saline, for example, chlorhexidine at 0.1 or 0.5, with enough pressure to, instead of you having to scrape the wound, you're using the liquid to actually lavage the wound. So when you do that, it's a more physiological way to remove bacteria, to remove debris, dead tissue from the wound. So it's very much used. So lavaging the wound is not just like sprinkling a little bit of disinfectant. It's actually, there is a lot of pressure, and the type of fluid is important in the use, because there are going to be certain disinfectants or even just water that will delay the healing of the wound, such as like betadine. You never use betadine at its strength. You have to dilute it generally to 0.1 to 0.2 percent, and that's what I say here, povidone iodine. Stronger concentrations of that will cause necrosis of the tissue. Hydrogen peroxide is something that can be used, especially initially in a puncture wound, to try to kill all anaerobic bacteria. But after that, it should not be used, because remember I talked about reactive oxygen species. The hydrogen peroxide will have a lot of that, and you are going to start killing new tissue, and so that's not ideal. So hydrogen peroxide is great initially, but after that, not so good. And then I think the best disinfectant is chlorhexidine at 0.1, 0.5, up to 1%, but a little bit less is probably better. How do we know? So generally, betadine, which is povidone iodine, you dilute it enough to make like a sweet tea or iced tea concentration color. There is going to be a PDF for handouts for dressings and different ways to address a wound. It's important that you guys read that. But one of the things that is important too is when bandaging a leg, it's important that we understand that it doesn't matter the way that you do it, like counterclockwise or clockwise. What matters is that you keep the pressure even throughout the bandage. And also what matters is that whatever you do in one leg, do the same for the other leg. So if you're going to do tendons in or tendons out, that's important. This obviously is, there's a lot of padding in this leg. If you're going to just do like a standing bandage, if a horse is going to be in a stall for a long period of time because he's hurt, and you're going to do a standing bandage, it's important that you do quilts or pillows under your bandage, because the pillows or quilts are going to distribute the pressure evenly, so you prevent cording of the tendon. So cording of the tendon is something that can happen fairly commonly. So it's important that you add the quilts and pillows. And then obviously in this case, there's going to be cotton here and vet wrap there. This is just the way that a lot of wounds are made. As you can see, this is on top of a joint. You use buttons to try to reduce the tension on the incision to prevent adhesion. So this is something that is used. As you can see, it's very important when you board your horses in places, it's important that as a horse owner or a farm owner that you understand how accidents happen. Like a boat like this should not exist in a farm. As you can see on a post, this horse passed on and opened up his abdomen, and that's a problem. So here you can see the suture. I think they stapled a lot of staples, and also you have drains in there because there's going to be a lot of fluid collection here. So you add the drains to prevent, because a lot of exudate, this fluid collection, this exudate or even transudate can lead to bacterial infection in the wound. But as you can see, this is a very nice wound that has been cleaned well. They clipped the area really well. So the addition of drain or not is important too. So this, as you can see, they think that this horse here was actually attacked by a lion. So as you can see, a whole cut all over the horse. I think this was in Colorado. And as you can see, it's very wide, okay, the skin, but after cleaning, in this case, they actually didn't clip, which bothers me a little bit, but the amount of drains that they added, and this probably took 5-6 hours to finish this wound because of the dimensions of this wound. And the horse, you know, the area heals really well too. Then talking about boarding horses and stuff. So, you know, every time that you have a bucket, the clips always have to be turned inward, because horses will clip their noses to these carabiners and clips, etc. So it's just you never leave the clips, you know, backwards. That goes also for blankets of this horse, like winter blankets. The clip needs to be inside and not with the clip to the outside, because horses will clip themselves to it. The other thing too, things just around when horses, you know, can get loose. In this case, it's a manure fork hanging around, and it just went all the way into the leg of the horse. After it was pulled out, this is what came out of the leg. The problem with wounds like this came out clean, as you can see, but sometimes you can have a lot of splinters of wood being left out inside the wound, and that becomes a problem because it's super contaminated and it's a foreign body as well. Same goes for this. So here's the thing. Things cannot just be, things that horses can get hurt cannot be laying around in a farm, okay? Or when horses, a friend of mine let her horse graze in her front yard where her trailer was parked, and the trailer was parked with the truck, and the horse put his head under the gooseneck of the trailer and just broke his neck right then. So horses should not be allowed to graze when there is machinery around. I mean, you can hand graze them, but they cannot be loose where there is machinery, there is metal, there's all sorts of things. Now, one of the things that I have seen also is that horses that are more valuable will die and stuff like that, and horses that have zero value can live with metal everywhere and never get hurt. And I think that that's true for everything. This is, like I said, the age of the wound. As you can see, this wound is in a horrible location, a lot of movement happening. The size of the leg already shows that this wound is super old. It's just very, very hard to heal. So in this case, it probably should have been immobilized from the beginning, so the horse wouldn't be moving this leg very much. This is another wound. As you can see, this is bone in the leg. It just sucks to see something like this, and it will heal, but it's going to leave a nasty scar in there, and this is going to take 2, 3, 4 months to finally heal completely. But this just, you need to bandage this wound, so to protect this bone, because if this bone gets dry, it will die. And then if it dies, it's close to impossible to bring it back. This is, again, a lot of granulation tissue in horses, a wound that happened, I don't know, 6 months ago and was not tended to. And you can see it just becomes nasty everywhere, dry, nasty, a lot of granulation. There's close to nothing that can be done at this point. So at this point, I just try to see if the horse is suffering or not. And if if he's super lame, if he can't walk, some horses walk normal with this, and some are just super lame. So it's something that very hard to address a wound that is already 6 months old like this. And this here is a wound that was, as you can see, it's a tiny wound. And this wound was contaminated with a fungus. Nothing was allowing it to heal. A lot of treatment, nothing was healing it. It went to surgery to be debrided. In surgery, they saw it was all black of fungus. They cultured the area, they put a drain, but after we removed the stitches, the wound just came back open, and it just continued to become bigger and bigger. And this is actually my personal horse. It just became bigger and bigger and bigger. And that's the importance, again, of knowing what you're dealing with. In this case, when you were dealing with this fungus, and this fungus is very hard to kill. It's not, it's fusarium, and it's close to impossible to kill. One of the only things that kill this fungus is actually iodine. So in humans, sometimes they receive iodine via IV, but it just damages a lot of the skin. So we tried a lot of treatment, and it just kept oozing. And the thing is, this wound was actually inside like this big. It just kept becoming bigger and bigger. Finally, we started using a product. It had to be multiple times debrided. He had to be put under again to open a new opening. And finally, we started using a product that is for patients that have diabetes, that have those bed sores that are also infected with this type of wound. It's an iodine-based product, and that's what was his saving grace. But this took, to the date, 4 months. A wound that was this little, a quarter of an inch, took 4 months to be able to heal. So this is what I have for wound management. If you have any questions, don't hesitate to contact me.